Egg freezing has now become extremely mainstream. There used to be a time when we weren't very good at freezing eggs, partly because eggs are very large. They're the largest cell in the body, and their cytoplasm contains so much water that when we tried to freeze them, ice crystals would fall inside the egg, as a result of which they would die when we would thaw them. But today, the technology has become much better because we can vitrify these eggs. That's called flash freezing. It's instant, as a result of which there's no ice crystal formation. So that in good clinics with a good embryologist like Dr. Sai, our survival rate for these frozen eggs after thawing is literally 100%, which means these frozen eggs are as good as fresh eggs. So why would you want to freeze eggs? Now, many years ago, the only time we froze eggs was for medical reasons. For example, women who would have, let's say, breast cancer, who would require chemotherapy, and who therefore would need to preserve their future fertility because chemotherapy would destroy their ovarian reserve because it would kill their eggs. But now, because the technology's become so good, egg freezing is no longer reserved just for medical indications. We also do what is called social egg freezing, and in fact, social egg freezing has become much more popular as compared to medical egg freezing because thankfully, not many young women get breast cancer. What does social egg freezing mean? It means we're giving women the choice. We're empowering them to decide when to have a baby. Now, in the past, professional women, especially, always had to balance whether they should pursue their career or whether they should have a baby. And it was always a hard choice because if you decided to pursue a career, you would sometimes have to wait till about 35 or 40 before you were ready to have a baby because it was hard to take a break. The pregnancy break, the maternity break, because typically most of these women wanted to be extremely good moms. They wanted to devote a lot of time and energy to their baby when they had a baby. So they would wait till they were financially stable, till they had enough time to be able to make sure that they would provide top quality parenting care for their children. It was hard to do this when you were a junior employee, while you were going up the career ladder, as a result of which a lot of them would have to compromise. And then by the time they became an executive vice president at the age of 40 and they reached where they wanted to be at their career, they found that their eggs had become too old and they weren't able to have a baby anymore, which had caused them major angst and lots of grief. Fortunately, the option of egg freezing now allows you to have your cake and eat it too, so that you can pursue your professional career and just take about 10 days off so that you could freeze your eggs, so that you could use these eggs then 5 years afterwards, so that you could then postpone having a baby safely because you're using young eggs. So not only are these young eggs much more fertile, they also chance of having a baby with a birth defect would go down. Because remember, as you get older, nothing happens to your uterus. It's only your eggs which get older. And once we've frozen these eggs, we've frozen your biological clock. Your ovaries will continue aging, but your eggs will remain young because we've frozen them. And this will actually help you to be able to plan your family so that you can plan both your career as well as how many babies you want and when you want to have them. I hope this was helpful. And as an IVF doctor, I take pride in sharing my knowledge with IVF patients to help you get the best possible medical care. If you have any questions, please feel free to email us and we'll be happy to create a video to answer your questions.